Welcome to the Wellness Abundance Podcast. I'm Melissa King, your podcast host, certified master health coach, certified personal trainer, and founder of Wellness Abundance Coaching. The purpose of this podcast is to share healthy lifestyle tips to empower you to design the abundant life you want and deserve. I'll chat with inspiring people who have built a strong foundation to build a life they love. I believe we all have the power within ourselves to create wellness abundance in all areas of our life. We simply need to find the courage within ourselves to take action. Our vision for this podcast is to help you create wellness abundance in your life with clarity, empowerment, and flexibility. Grab your favorite beverage and enjoy the episode. All right, welcome back to the Wellness Abundance Podcast. I am super excited to have Dana Salisbury Duarte. She is a nurse practitioner on with us today to talk about a very exciting topic that I know is really, I want to say it's like all the rage in the weight loss space now. And it's something that I actually don't know a lot about, have just kind of heard bits and pieces. So I'm super excited to have Dana here to kind of do a deeper dive into just weight loss drugs. So Dana, if you want to introduce yourself.
My name's Dana. I'm founder of a clinic called XOXO Med Spa in Ventura. I'm a nurse practitioner and I specialize in regenerative medicine, hormone replacement therapy, food sensitivity testing for gut issues, and a lot of aesthetics. So one of my most popular treatments that is all the rage is the weight loss medication semaglutide.
Awesome. So I also want to, because I noticed in the notes that you sent me that, that you do offer food sensitivity testing for gut issues. So maybe if you want to, you could come back on and we could do a deeper dive about that. And then also hormone replacement therapy, because I know those are two things that can come up a lot, hormone replacement therapy, especially with the women that I work with specifically, and then just food and sensitivities in general. So, but let's dive into the weight loss drug. So I'll let you kind of start and just what are weight loss drugs? What do they do? Are there what specific one do you prescribe? Just if you could just give us a brief intro on weight loss drugs.
Sure. Okay. So the newest weight loss drugs that everybody is excited about there are several of them. So one is called Ozempic, one is Mounjaro. My favorite is semaglutide, and I'm not listing all of them, but those are the ones that I'm more familiar with. They're basically classified as GLP-1 receptor agonists. So essentially what they do is they make you feel not as hungry, and then they have some other medical based mechanisms of action.
Cool. So they kind of suppress your appetite a little bit. And there are some other health benefits to it. So what would be the one that semaglutide, right? I pronounced that correctly, right?
Yeah.
Okay. So what is the difference between that one and Ozempic, which I feel like from what I've heard is the most popular one?
Yes. No, that's a great question. In essence, they are very similar, but they're different too. Semaglutide is not as strong as Ozempic, and because it's not as strong, it has less frequent side effects. So when you're using a name brand like Ozempic or Mounjaro, I think Kim Kardashian's talked about Ozempic, lots of other movie stars, you're using basically a preloaded pen. So it comes in a pre-inject, easy to use way to treat yourself on a weekly basis. But what happens with that is when you inject it and you're ready to use the next level of dosage, it's doubled in amount. So you can imagine if you're doubling the amount of medication that you're putting in your body, you're probably also doubling your chance of getting a side effect. that is unwanted. So with semaglutide, it's compounded. So it's office use the way I do it. It's drawn up into a syringe, and then I titrate it based on my patient's needs. Basically, because I draw it up and it's compounded, the amount of medication that you receive as a patient is not predetermined by the manufacturer. Less side effects.
Okay, that's really interesting to me because I had no idea how Ozempic was administered. Like there's so little. So this is a very exciting conversation for me to have right now. So Ozempic is more basically kind of like a one size fits all in a way, if that's what I'm hearing you say.
Has a couple of levels to it, but yeah, essentially, like if you are on level 1 and you're going to level 2, there's no 1.5 level.
Okay, so there's kind of no in betweens. You're either at level 1 or level 2. And how many levels are there?
So there are a couple of different levels with Ozempic. So you start at the loading dose and then they double it, then they double it again, and they can double it again. And then that's basically where they top out.
Okay. All right. And how often do you, so for Ozempic and semaglutide, how often do you get the drug administered?
So it's a weekly injection in the fat.
Oh,
Yeah.
okay. So it's a weekly injection. So every week you have your patients come to you and you, based on like an assessment or evaluation of where they are in the moment, then you decide which dosage would be appropriate for them.
Close. So what I actually do
Okay.
is I'll do the injection in office and then I send them
Okay.
home one additional week. So they do
Oh,
come back to me every other week, but that way I can watch them closely. I can see how they felt, check in with them, and then adjust the medication based on whatever's going on with them or whatever they're even planning the next week.
okay. Okay, cool. So it's very closely monitored by a licensed nurse practitioner like yourself,
Yes.
a professional. Oh, cool. So is Ozempic the same?
No, it's not exactly the same. Anything that is have the GLP-1 receptor agonist, it does the same mechanism of action, but there's also like the strength of it is stronger. So like the parts per million is more if you're getting a name brand like Ozempic. Semaglutide is not as strong. And it's a slightly different medication. It's kind of like Advil and Aleve. They are both anti-inflammatories. They can both take care of your headache or your inflammation, but they're not exactly the same drug at all.
Okay, okay, that's a great analogy. Like the difference between like yeah, Advil and Aleve. Okay, that puts things in perspective for me. That helps me understand better. Okay, so let's dive a little bit into like how semaglutide actually works in the body.
Okay, sure. It's a glucagon-like peptide 1 that it really acts upon. It's a receptor agonist. So basically what happens is this attaches to a receptor and it activates it, which enhances insulin secretion from the pancreas and it slows down gastric emptying.
Okay, and what's the benefit of that happening in the body compared to weight loss?
Okay, so twofold. So one is basically like very technical, and then the other one is like really easy to understand. So number one, insulin is a hormone that takes sugar from your blood into your cells for energy. So it's how you have energy. Every cell can have energy to use. So given that increases this insulin receptor and makes it more active, it's very helpful to people who are insulin resistant. So type 2 diabetics to pre-diabetics, people who have given their bodies too much sugar over time, because especially those people have damaged their insulin receptors.
Mhm.
So most people don't know, but taking in a lot of sugar actually damages the vascular lining, causing inflammation, and then that leads to other health issues. So not just insulin resistance. So the GLP-1 receptor agonists, like semaglutide, they help create an opportunity for the body to clean up some of the damage that's inside of the vessels from the excessive American lifestyle.
Yes.
Yeah, so that's kind of the
Yeah.
complex thing. And
Okay.
like the easier to understand thing is slowed gastric emptying. So basically you feel full longer. So for people who don't have like an actual insulin problem, it's still going to act like an appetite suppressant. So you feel full longer, you feel less hungry, and essentially you lose weight because your appetite is suppressed. Now with that, then there comes a point where I really need to encourage my patients to be mindful, to have bowel movements, intentionally eating things that help them. So like if you eat less, everything's gonna move slower. You don't get that point where the bowels are putting pressure on the colon to vacate. And sorry to be gross, but that's just what.
Hey, you know what? Having bowel movements is like regular bowel movements is a part of health. So
Right.
go for it. I'm all about talking about this.
So I tell my patients eat psyllium so you have that bulk and
Mm,
that will help the stretch receptors vacate. You can also eat like yogurt or take probiotics for enhanced digestion, and also like enzymatic food like papaya or pineapple. Those are all options that seem to work. You don't have to do all of them. You could just do one. If that doesn't work, do another one. And then I also tell people to drink a lot of electrolyte enhanced water because I think it's about a third of your hydration comes from foods. And since you're eating less, you're going to have less of that. And because you're not eating foods, you might not be as thirsty, because a lot of times we'll drink water with food. So yeah. And then another thing that I'll tell people just to help them is to try taking magnesium, because that will help. Like the Calm product is really good to just help you keep nice and regular.
yes. We take Calm just about every night, like an hour or so before we go to sleep to help us sleep better, recover from our workouts, and yeah, and help us stay regular.
Yep.
Just
Check.
just just be very mindful of how much Calm you take because you don't want to be too regular.
Yeah, you don't want to overdo it. You don't
You don't
want
want to. Yeah, I've definitely done that before, and it's not very fun, but yeah. So a lot of people who are, overweight or in the obese category, they tend to have issues with insulin resistance, like you said, meaning like the body just can't really process any sugar efficiently, basically, to put it very plainly, and you described it very well, Dana, as well. So I have a better understanding of why these weight loss drugs can be so effective. So this is really interesting. So what are some of the side effects from these drugs?
Oh, okay. Well, there are some fun side effects. In fact, there are many, many, many side effects. But like I said, if you're on the strongest type, the Ozempic, then you're going to experience more of them. And semaglutide, although there are a long list of side effects, my patients don't frequently have many of them. Like I hear a little bit of nausea, I hear a little bit of constipation. And I know that there are many issues that can happen because of it. And they probably haven't even discovered all of the potential side effects. As you can imagine, every body is different. But one cool thing that I did recently read about was how it can actually help with alcohol misuse disorder. So the ladies who like to have their wine every night and that's contributing to the belly fat and things, well, they just won't crave it as much, which seems to make sense if your body is not craving sugar because there's a lot of sugar in those
Right.
alcohol. Another great side effect is it's been really good for patients who have like chronic kidney disease, as far as like vascular events go, heart attacks and things, like 50% reduction in morbidity to because they're using the semaglutide. So those people who are already very complex, it actually really helps them. And it's really it's that GLP-1 action that's so great. So yeah, in my practice, as far as side effects, the girls tell me they're not really don't want to drink as much. The ladies tell me that. Not that they're alcoholics or anything. They tell me maybe a little bit of constipation, and that's when I remind them about the foods and calm and probiotics and things like that. And then a tiny bit of nausea it'll come just for like maybe a minute, maybe 2 minutes, and then it'll pass. But I can still prescribe something like Zofran, an antiemetic, so that you don't feel that discomfort. So most
Mhm.
people, it's very manageable with semaglutide. Unfortunately, unlike Ozempic, when I've had patients who are on Ozempic, because their insurance pays for it, so they don't want to switch over or get off of it. They just feel lucky to have it covered because it's such an expensive medication. But then they're just sick and throwing up or even a hospital visit because they've been so ill from the medication, and it really affects their quality of life. I mean, you get the good, you get the bad, but that's again why I like to monitor things carefully, because I want my patients to be successful and happy,
Mhm.
not sick and skinny.
Yeah, yeah. If you're skinny and sick, then what's the point of taking all of it? Yeah, I know, and that's where I feel like, yeah, that's one reason why I am so excited to be talking with you specifically about this is because you and I have pretty much the same values and beliefs and priorities when it comes to health and nutrition. So yeah, so you definitely want your patients, yeah, to be healthy and happy and lean because also, excess body weight, can lead to a plethora of other issues. So yeah, and actually, if we can kind of go into a little bit about, and we could talk more about some other side effects too in a minute, but speaking of this, I'm curious, like, what would be an example of a patient that you would recommend semaglutide to?
Um, Go ahead. Fair question. So I would say typically, women, we have trouble with perimenopause. We gain the extra weight, things start changing. All of a sudden, there's a cholesterol issue, according to the labs, or, belly fat, things like that. That's usually what brings my patients in, is the change that they're seeing in their bodies around middle age.
So before we dive into some of the other side effects that I know you've kind of mentioned, when we were kind of chatting about what we were going to talk about today, I'm curious, like, how long do women need to stay on semaglutide? Every time I say it, I feel like I'm saying it incorrectly, but then maybe I'm not. I don't know.
You're saying it correctly, so am I. So.
Okay.
um,
Anyways.
Yeah, so it really just depends on the patient. So some patients just have like the, stubborn 20 pounds that they're trying to lose. Other patients, have a lot more. And then we just start and keep going until I get them to a healthy BMI and a place where they're comfortable reducing their intake of semaglutide. So it really is like a co-decision between us. And when you are ready to kind of taper off, what I'll do is I'll bring them down to, like, instead of cutting a weekly injection every 10 days and then every 2 weeks, and just kind of taper from there, just because they've got to still train their minds and bodies how to, in how much food to take in, what to put on their plates. And when you have hunger, you might change your habits and like overdo it if that's what your old habits are.
Mhm. Yeah, I have heard that women who go off of Ozempic just gain the weight right back. And I feel like it's because they just didn't really learn how to eat. Yes, their appetite was suppressed and they weren't eating a lot and they were losing this weight, but then they want to get off it for XYZ reason, but then they gain all the weight back and there's really, things you need to do alongside taking these weight loss drugs. You can't just
Yes, exactly. So tapering is important, but to your point, that exercise is so important because your muscles are your metabolism. You know, and if you just stay on one of these medications, you're going to lose body fat and you're going to lose muscle. Your body is going to take nutrients and energy from wherever it can. It'll even take it out of your bones. So, you know, we hear about osteoporosis and osteopenia and our susceptibility as we get older. Well, these are all concerns if you're on semaglutide and you are losing weight. You want to make sure that your musculoskeletal system stays nice and strong. So exercising, weight-bearing exercise is going to help maintain the muscle. And then your muscles are going to help you keep a healthy metabolism. And then basically it's just eating habits after that, nutrition, making sure you have enough protein in your diet and sticking with it. It's consistency. So nutritional counseling can be very helpful for people who are on semaglutide. And, you know, it's kind of tricky because some gals come and they really only have that last, like, it's not even a last 20 pound, it's just the 20 pounds that kind of crept up. And maybe it's not that noticeable, but then they lose the weight and it's easier for them to keep it off because they already have good habits. They've already been exercising and eating properly and taking in enough protein and reducing carbs. They've already done all that. Other people who are more overweight, they have a little bit of a harder time, and that's where you might see more of a rebound because they probably don't already have the good habits instilled into their daily life.
Yeah, that makes total sense to me. Total sense to me because it is hard. Yeah, because that was when Ozempic like started like becoming really big in the last couple of years. I was like, I don't know how I feel about this based on what I do as a health and fitness coach.
Right.
And
Why are they taking this easy way out? How is that actually going?
yeah, yeah, and I didn't quite understand it, and that's one of the reasons why I was so excited to talk with you today because, like I said in the beginning, I wanted to learn more about it because one of my health coaching friends, she works with a lot of women who are on this weight loss drug, and I have not worked with any women yet who are taking Ozempic or any other weight loss drug. So when my health coach colleague mentioned that, she's like, yeah, I'm basically neutral about it. If they want to take it, take it. But they're coming to me because they want to implement these healthy lifestyle habits alongside taking this drug that's going to help them kind of jumpstart their weight loss. And that's when it really kind of clicked in my head to like well, maybe there is something to this uh,
Yeah.
and a
And
benefit.
you're not the only one who's kind of like wondered or been hesitant and like how it does work hand in hand. So I understand like how it is kind of complex because you don't want to just have people cheat the system essentially and then be unsuccessful because the moment they stop, it comes back. But like someone like me, I want to advise them to eat properly and exercise, but not everybody is going to do that. And so it really is helpful for people who don't know how to do things rather than just getting a little bit of my time to go seek nutritional counseling and get the extra time and care and attention that they need to help instill those healthier habits.
Yeah, and that's what, like I mentioned to you a few minutes ago, one of the reasons why I was so excited to talk to you specifically about this because I know you are all about, the overall looking like stepping back and looking at the big picture of health. So, yeah. So, what else do you want to share with us about semaglutide? I know I probably messed it up that time, but that's okay. Ozempic or any other, like any side effects? What else do you feel like would be beneficial?
Okay, so one thing that I have heard, and you may have heard too, is about Ozempic face. Have you heard of that before?
I have not heard of that before.
Okay, so Ozempic face I guess in my community, we all talk and like we hear about it, but as far as aesthetics go, because there is such for the people who are losing large amounts of weight, they're going to end up with a more saggy face.
Mm.
So that
Mhm.
that is one of those, I didn't mention it earlier, but it is a side effect from weight loss, but they call it Ozempic face because if you're on it, you're gonna get it. I have a client who lost 75 pounds on Monjaro, which is, another kind of similar formulation. And she had developed such a turkey neck because she lost all this weight and then her skin was just sagging. So I did a thread lift for her and she was very happy with it. And then she lost another 35 pounds. She had a lot to lose. She was one of those. And so I did a second thread lift for her. And now she's like, okay, I'm good. And she's just maintaining. So,
Oh,
so I was
wow.
just glad that I could have a resolution for that particular issue as well.
Yeah. So can you explain what did you call it? A thread?
A PDO thread lift. So
Okay. What is that?
it's a non-invasive procedure where we basically reposition the fat pads on your face. So when your face ages or you have massive amounts of fat loss, you're gonna have that kind of like hanging excessive skin. But there's a few things that happen with age. You get some bone loss, so you lose that scaffolding. You get your fat pads slip down and you lose your collagen. All things that happen. No fun, but it happens. So people seek out a thread lift to reposition those fat pads, kind of put them back where they belong. And there's other little tricks we can do, like, replace bone with hyaluronic acid to create sculpt
Mm.
that jaw, and lasers and peels, microneedling, all sorts of things to like rebuild your collagen from your skin to help. But essentially, there's really no great way to reposition your fat pads other than surgery or a PDO thread lift.
Interesting. Okay. Okay. Yeah. Yeah. Because I've always wondered that with, people who were very, very overweight, like even in the obese category, like how their skin, how they would get their skin a little tighter and get rid of that loose skin without having to have uh, like
And that,
complete a
yeah.
neck lift, plastic surgery, anything like that. So
Yeah, and there's, I've heard Ozempic butt as well, but that's mostly muscle loss,
yeah,
less the skin being lax, I think that people are complaining about. So they're losing their booties that had muscle. But like I said, if you're not careful with your nutrition, you're gonna lose muscle that you maybe don't want to lose.
yeah. So like you mentioned earlier, making sure you're getting adequate protein.
Yeah, if you work out, you're gonna need that protein or those muscles are gone.
Yeah, exactly. So speaking of that, I get asked a lot by clients and just people in general, like how much protein they should be taking in. What are your thoughts on how much protein people should take in? It's women specifically.
Well, assuming there's no kidney issue or, reason why you can't increase your protein, I usually go by like 1 gram of protein per pound.
Yes, that's what I think too. And I have like, mentioned that to people too, and their eyes get so big and they're like, oh my gosh. Like, even some men, I kind of mentioned that too. They're like, whoa, that's a lot of protein.
Yeah, it is and it isn't though, because
Yeah.
once you figure out how many calories you should be eating for you, or even once you just figure out what you need to eat in a day to meet that goal, you still have some room, for some carbs and fats and things, obviously, but you just have to figure out what fits that category of protein, how much of it throughout the day, and then just kind of eat repetitively. So if you're a real foodie, you might have a little bit of trouble with that. But if you can just figure out, okay, I need a little bit of chicken or I need some yogurt in the morning. I need my protein powder. I got to have some steak at night. If you can just map that out, then I don't think it's that hard. You just have to get into a routine. And consistency and routines can be very helpful no matter what goal you're trying to reach.
Yes, and I'm really happy that yeah, first of all, you mentioned having a steak for dinner. And I love that it's coming from a woman who is a licensed nurse practitioner, because there's so many women out there who are afraid to eat like steak, and to meet their protein requirements. And I'm like you, where I'm like, I'll eat a full 10-ounce steak in one sitting if I'm really hungry and if my activity level has gone up. So on one hand, I'm like, yeah, I'm all for it. On the other hand, I get why women can be a little hesitant to increase their protein intake because of what we've been taught.
Mhm.
And
Yeah,
I'm digress.
that's not really your enemy. Sugar is, guys. It's sugar.
Yes, yes. Thank you, thank you, thank you, thank
Remember,
you.
it's the sugar that is damaging the vessels, and that's causing inflammation, and that's all those vascular issues, the heart attack, dementia, all those things that occur with inflammation,
Yes.
starting from the vessels, starting from sugar. And stress, by the way, because stress, your body compensates by creating more sugar in the blood.
Mhm. Yes, that is another thing that I heard a women's hormone specialist talk about in a webinar was listening to a couple weeks ago. She says that yeah, women, one of the first things when she's when a new patient comes to her, that's one of the first things she evaluates is their stress level, their
That's
cortisol.
actually probably, the best way to start. It's kind of a hard one to treat for sure.
Hmm.
I definitely struggle with that with patients at times because, people, you create your life, you create your reality. So if you have unresolved issues from childhood, or you have an abusive relationship or some toxic people at work, then you're gonna get that constant stress, fight or flight, and then that causes problems in the end, so that's interesting that she does, because oh my gosh, it's like you need a psychologist, you need a yoga instructor, you need a priest, like you need so many,
Yeah.
right, to try to so many people that might be able to help you, and I don't know which way would be the most helpful for each patient, but I do know that exercise is my number one, like, recommendation for people who are dealing with stress, and sleep. Those are two.
Yep. Yeah, and I found that when I'm working with clients, like they don't really think about like stress and sleep and how those two factors have such a huge impact on weight loss. So for those women who are on these weight loss drugs, when they're looking to like wean themselves off of them, like you said, you taper them, you taper their dosage as they want to get off it. And like really maintaining good sleep habits, getting that quality sleep, and managing your stress levels more effectively can be huge factors in not gaining that weight back that you've lost while on the weight loss drug.
I basically should just send everyone discontinuing to you because that way I know they'll get the counseling that they need on these specific things. I just, as a practitioner, I love helping people, but I just don't have the time to like dive
Yeah.
into all of those things.
Yeah, and that's why, I always get excited when I meet, practitioners like you and other health coaches in my community. I encourage them, like, connect with other practitioners because they simply don't have the time. Like, a lot of them actually really truly want to help their patients. They just don't have the time, the capacity, the bandwidth to do it. But yeah, I feel like also, when I'm working with clients too, even if, say, they don't lose a lot of weight, within our time together, 99% of the time they tell me by the end of our coaching sessions together that they just feel better overall. They're sleeping better, they feel more relaxed, they're calmer, they have better energy levels, and yeah. And that's important too, because you said you get a lot of women in perimenopause, with the hormone fluctuations going on in this season of our lives, low energy can be a side effect of all this.
Yeah, no, and like basically going back, like the therapeutic value of what you're giving your clients, it's all about prevention, and even in medicine, prevention is key. So when they feel better, when they sleep better, when they have more energy, who knows what cancers and things you are helping to prevent, because they feel better, likely their inflammation has improved.
Mhm.
And some of that you can see on labs, brain scans, things like that.
So, what else would you like to share about the weight loss drugs? Anything that comes to mind that you want to wrap up with, or?
Well, I guess it's just important to know that even though it's like a miracle drug, it's not really the answer to good health. So being thin does not equate good health. There are just, like all the things we've been talking about, a lot of different aspects that you need to monitor and manage. And of course, I love helping people with semaglutide because it's effective for them and they feel good, and I can check in with them frequently and make sure that they're progressing in a positive way. But it's not everything. It's funny that once you solve one problem, then you'll find another one to solve. So just enjoy the road, because it's all a road, I guess, for all of us, the journey of health.
Yes, yes. I love that you say that because yeah, it's so true. It's definitely so true about that. It's just the never ending. I mean, the day our health journey ends is the day we die. Honestly, if you think about it, then we're like, woo, we don't have to worry about any of this
Yep.
anymore.
Yep.
Um, but yeah. Cool, awesome. Well, this was such a great conversation, Dana. I really appreciate you taking the time. I know you're busy. You have a practice in a med spa in Ventura, and you're opening one in Thousand Oaks, right?
Yes, becoming
Soon.
soon.
Yeah, yeah, that's very exciting. What would be the best way for someone, if they're local to Ventura County, to connect with you?
Best way is probably just through my website, or Instagram. So I have a lot of information on my website, health kind of things that I do. And then on Instagram, because it's such a visual thing and Instagram is all pictures, I have a lot of aesthetics things. So whichever one you're interested in, you can contact me in either way that makes sense for you.
Yeah, cool. Yeah, I do follow you on Instagram, and it's fun seeing all the cosmetic and aesthetic things that you do on
Yeah.
there.
So it's XOXO Beauty Med Spa, and XO www.xoxobeautymedspa.
Cool. I'll make sure to put it in the summary in the podcast. So everywhere, YouTube, Apple, Spotify, I'll make sure it's in there, and so they can connect with you. So cool. I have one more question to ask you that I ask everyone. When you hear the words wellness abundance, what do you think of?
A blessing.
Mm,
Yeah. Because if you don't have your health, I mean, the quality of life is just like, why? I mean, that's how I feel. I've been I broke my neck as a teenager, and I didn't,
wow.
I was down and out for about a year, and I tell you what, if you have your health, you're living. If you don't, you're not living, you know?
Yes. Awesome. That's a great answer. I've not had anyone share that answer before, so I love it. That's cool. So awesome. Well, thank you so much, Dana. I'm so excited we had a chance to connect. And yeah, and I look forward to having you on again if you're open to it. And yeah, help you share your expertise with everyone in our community. So
It's my pleasure. Thank you for the invite, and I'd be happy to come back.
cool. Awesome. All right. We'll talk to you guys later.
Bye.
The Wellness Abundance podcast is sponsored by Wellness Abundance Coaching. At Wellness Abundance Coaching, we help women lose weight effortlessly and minimize anxiety with clarity, empowerment, and flexibility. We offer one-on-one and group health coaching, corporate wellness programs, and on-demand fitness videos. To learn more about how we can help you become the healthiest version of yourself and to schedule a time to chat with us, visit melissaking.net.